start on time. Let me welcome all of you who are online. We really, truly appreciate your participation in WBS Leadership Dialogues. As I always say when I start these dialogues are not aimed at throwing stones and blaming, are aimed at trying to resolve the challenges that we're facing in our nation, in the continent, and in the world. So we're in a solution mode here, and we are not analysts that are trying to score some political points. So we are here to really look at the problems that we're facing in this continent and marshal all the wisdom, the intellectual horsepower, and the experience of people like Dr. Stavros to share their wisdom and experience so that we can all learn, and in our areas of influence, in our businesses, in our academic institutions, we can be able to collectively tackle the problems that are facing our continent. We know our continent is faced with major ills of inequality, poverty, and unemployment. And then obviously the pandemic has set us back even with all the advance that we have made in these areas. So the topic today is the COVID-19 pandemic and the imperative of building agency for Africa's drug manufacturing capacity. I am in conversation with Dr. Stavros Nicolaou, and let me just tell you about him briefly. He's got a very long CV. But what I really like about Stavros is that I've known him for a very long time now. I would say we've grown up together, being patriotic South Africans, doing our best to make sure we build this country in the different spheres in which we are. Having been in energy, he's been in healthcare. We've been together in Busa. We've been together particularly when the pandemic hit, and he's leading the business for South Africa in terms of partnershiping with government. We've been together when we were meeting the president and meeting the government on all the business issues, and he's played quite a role also in our liberation struggle and with the stalwarts of the struggle. So he comes a long way. He's not a person who's being parachuted in this place. But I have a huge respect. Stavros, let me call you now. His official role, he's a senior executive, group senior executive responsible for strategic and trade development at Aspen, Africa's largest pharmaceutical manufacturer. And he's also got 30 years, 3 decades in South African and international pharmaceutical industry. He was very instrumental in the first generic ARVs on the African continent, developed by Aspen, which has gone to save hundreds of thousands of lives. And you know, during the pandemic of HIV, ARVs was a big, big issue. And he played a leading role in that. He's got a long CV. If I can continue with the long CV, we won't finish this session. So welcome, Stavros. What I'm going to do is give Stavros 10 minutes to basically indicate to us what Aspen is doing in this space, and what are the challenges, what are the opportunities, and what we as the continent can look forward to that. And then from there, I will ask quite a couple of questions to him. Let's make this a dialogue. If you've got a question, please put it on the chat. We will look at it and then we'll ask him. Don't hesitate to be engaged. Let this process be an engagement between Stavros and Wits Business School leadership. My name is Maurice Gqeberha. I haven't introduced myself. I'm the head of and director of Business School. So, Stavros, over to you.
Professor Gqeberha, I'm going to call you Morris.
Go ahead.
Hereinafter.
Yeah.
Thanks very much for an exceptionally warm welcome. It is, of course, always the greatest of pleasure to speak at fora such as this, particularly those that are arranged and assembled by my alma mater, Wits University. So it's indeed a great pleasure. The topic of conversation today might seem to be one that has kind of drifted into some level of steady state.
Yeah.
But I do want to caution against that. And I will unpack a little later on why I am raising somewhat of a red flag, not entirely red, but it's sort of between orange and red, I guess. And I will unpack in a few moments why I am raising that flag. But suffice to say for the moment, I want to cover three areas very briefly, high level. Firstly, let's just reflect on where we are with the pandemic at the moment, globally and in the country. I think secondly, I want to speak a little about some of the challenges that we experienced with respect to local capacities on the continent. Yep. And then thirdly, which will be the main focal point, I want to expand a little on what Aspen has done on the continent to get us into a position where we can lessen the grip of the developing nations on the supply of vaccines to our continent. So I think the most obvious starting point is let's reflect a little on where we are at the moment. So we know this pandemic was first recorded in December 2019 in China. It was declared a pandemic by the World Health Organization in January 2020. We had our first reported case of COVID on the 5th of March 2020. And 23 months on from that date, we have now experienced a little over 400 million cases globally. And we've experienced 6 million deaths that we're aware of course. The fatality rates are often underreported. So 6 million deaths. The figure in our country, there's an official figure and then an extrapolated figure. The figure in our country extrapolated is probably closer to around 350,000. These are deaths that we would not normally experience. So there's been a significant impact on lives and on livelihoods. I'm not going to delve into the detail around that, other than to say that the big hope that we had was to administer vaccines as efficiently and as swiftly as we could as a global community. And of course, when the pandemic broke, we never had any vaccines anywhere in the world. And we looked at what therapeutic interventions can we intervene with. And of course, there were no new antivirals at that stage either. So we took antivirals off the shelf, tested them, and we also looked at repurposing certain medicines. And I'll spare you the detail of that, but one medicine that did shine through, which was a repurposed medicine, it was a cortisone, a corticosteroid called dexamethasone. That became effectively used in around June or July 2020, and that reduced the mortality rates by 35% for patients that were being ventilated in ICU facilities. That was a very important development, Maurice, because what it did is it lifted the hopes for the first time of the clinicians. So these clinicians had been for 6 months backs to the wall, losing patients, ventilated patients, 60 to 80% mortality rate. So now when you get a small breakthrough of dexamethasone, 35% reduction in mortality, it lifts the mood, it lifted the hope and the morale of the clinicians and the nurses. Then, of course, we started seeing towards the end of 2020 that the first vaccine would become available. This was a tremendous human feat, a tremendous scientific feat as well, because we were able to introduce a vaccine to market in the patient's arm in 319 days, which is a record time. And many said, but there's been shortcuts. And in 2021, we'll feel the impact of that. And of course, we've now administered close on 11 billion doses of vaccines. And none of what the doomsayers were saying, that there were shortcuts taken, that these vaccines would kill people. On the contrary, these vaccines have been amongst the safest that we've ever experienced in the 2 centuries that we've had vaccines. Very good efficacy rates and very good safety records as well. So we've administered 10.6 billion, that's why I said close to 11 billion. But in administering these 11 odd billion, when the pandemic first broke out, the global community said we're going to act in solidarity and we're going to help each other because none of us are safe unless all of us are safe, right? Well, guess what? When the first vaccine started coming out, we realized that was all lip service. There was, in fact, very little, if any, solidarity. And it became like Hunger Games. If you watch Hunger Games, it was each man to himself, and whoever could get their hands on vaccines. And the bigger your wallet and the deeper your pockets, the more likely you were to get vaccines. And in fact, many countries in the north landed up hoarding vaccines. For example, Canada, in the early phases, had either acquired or was acquiring 5 times more vaccines than the entire population. And yet, the South, primarily Africa, could not get vaccines. And even as I speak to today, 72 of the low-income middle countries have only received 8% of the world's vaccines. Sub-Saharan Africa has received less than 10%. And there are around 18 African countries that have only vaccinated 5% or less of their populations. So that's not a good track record. It doesn't speak well of humanity, and neither does it speak well of solidarity. So what is the logical conclusion that one draws? The logical conclusion is that local capacities solve local problems. In the midst of another outbreak of a vaccine or even an up mutation of COVID, Omicron certainly won't be the last variant that we experience. There will be other variants. Hopefully these other variants continue the down mutatory trajectory that we've seen, but there's no guarantee around it. And even if you get as passive a variant as Omicron was, it's still highly transmissible. People still get infected, and vaccines are the most effective way of preventing transmission. Why is that? Because many people have said, well, if I've had this, or if it's coming to an end, why must I get vaccinated? Well, the answer is quite simple. Those who, and there's very good evidence now, and I'm citing figures out of the New England Journal of Medicine, the infection rates in those that are vaccinated is 68% lower than those who are unvaccinated. So the best way to protect from transmission and to protect communities is in fact through vaccines. These vaccines also have, and I'm not going to get into a pharmacology lecture here, that's not the intention, they have a dual effect. On the one hand, the short-term effect is they stimulate the antibody response. So the foreign body enters, and this is the first line of defense, if you want to call it that. And the antibody then neutralizes or attempts to neutralize the invading antigen. There's a second part to this, and that is what we call the T cell response. So the T cell these are memory cells, they recognize these viruses. And if these viruses manifest again, or even the existing virus, then they kick into motion. So think about them as the cavalry. So you've got the first line of defense, the antibodies. The T cells are the cavalry. So there's a good rationale to being vaccinated, even when we are reaching a steady state or a down mutatory state, as we are seeing at present. So that means that even though we're in a different trajectory, there are, as I said, 10% or less of sub-Saharan Africans have been vaccinated. There is, of course, still a need to vaccinate Africans. A sad indictment is that, much of Europe have received booster shots, and yet many of our people in Africa have not as yet received a single dose. So you can have a fit 25-year-old in Europe with a booster shot, and boosters are really important, incidentally, in preventing further mutations and variants. So you can have that scenario, and then a 75-year-old African lady who has not even received a single dose as yet. So let me go back to this thing that local capacity solve local problems. Never a truer word spoken, but the realities are that Africa imports 99% of its vaccines. It produces 1% or less of its vaccines. So how do you now suddenly spawn an industry where you're going to start putting vaccination sites in various parts when the world is so far ahead of you? So let me focus a little on what Aspen did. Aspen, for those of you who don't know, is a fairly young company. We are 24 years old. In that 24-year period, we've taken what was very much an insular South African business and we've globalized it. I think we are the most globalized South African company. If we're not, we're certainly in the top 3. We have an active presence in around 60 markets globally, and you feel the impact. So today, when you have Russia invading Ukraine and you've got a business in Ukraine and a business in Russia, it brings a different set of complexities. The only point I'm trying to illustrate is we have a global business. And in the midst of that global business, we have strategically moved up the manufacturing value chain. So we started with very basic manufacture. We always saw manufacturing as a South African strength of ours. And we started moving up progressively up the value chain, basic compounding of tablets and capsules up to making sterile products. Sterile products are very complex products to manufacture. So in 2019, this is a few months before the pandemic broke, Aspen had at that stage become the world's largest manufacturer and supplier of general anesthetics and muscle relaxants. These are muscle relaxants that you would use, for example, to ventilate patients. So what do you need to ventilate patients? You need a muscle relaxant and a general anesthetic. So a wonderful South African story to be able to say that you are now the largest supplier in the world of general anesthetics outside of the United States. Who would ever have thought? We traditionally, as South Africa, seen as a mining commodities, maybe banking, financial services. We've never really be seen as a high value add pharmaceutical jurisdiction. So now you've got this capacity. We made a 3.4 billion rand investment in sterile capacity, and we relocated our manufacturing of general anesthetics to Gqeberha, formerly Port Elizabeth. And we now watch this pandemic unfolding before our eyes, and as a management team say, well, what is it that we can do to help the situation? And initially, we helped with dexamethasone, but soon we realized the sterile capacity was a very valuable capability to have. And we realized that we didn't even need to pivot or repurpose anything. We could just allocate capacity to manufacture what we would call fill and finish vaccines. So these vaccines come in vials, they're sterile vials, you insert the liquid, there's a rubber cap that fits snugly into the vial, and there's a rubber stopper that goes in there. The rubber stopper is where you insert the needle for the vaccine. So we had this capability. We're about the only ones that had this capability in scale on the African continent. I'll spare you all the detail, but what did happen is we looked around and said, who do we partner with this? We soon realized that the Johnson & Johnson vaccine is the most demographically and also logistically friendly and temperature friendly vaccine for the African continent. We partnered with Johnson & Johnson initially under contract manufacturing arrangement. J&J went through 120 different contract manufacturers to try and select a group of around 8. And they selected us as one of the 8. It's Aspen. They had their own facility, so that's 9. So to put that in perspective, Johnson & Johnson is a company, I think they're a monolithic juggernaut. They're really, really big. In fact, their market cap is 1.5 times the size of South Africa's GDP. So that's the entity you're dealing with. They have significant global health and other influence. So to be selected by Johnson & Johnson to manufacture their very own product, not just any product, it's a product that is being used in a pandemic, is certainly recognition of the capability that exists in our country. So we should never doubt ourselves. We say, well, how good enough are we? Well, I think here's a good example where a South African company made it in the top 8. It's the only one in the Southern Hemisphere, incidentally. And the story got better than that because we might have been the 8th to be selected, but we were the first to get product out. And to date, we have produced the most Johnson & Johnson vaccines globally. We've produced around 170 million doses. So 170 million people would have benefited somewhere in the world, mostly in Africa, from the South African technology and a South African company. So instead of going greenfield with trying to solve a problem, we made our capacities available. But we did that initially on a contract manufacturing basis. So contract manufacturing is just one way of addressing the problem, but it has weaknesses. And what are those weaknesses? The first is that you don't own that stock. So you don't allocate where it goes to, you don't distribute the product. So there are disadvantages. And I must say that Africa, President Ramaphosa, firstly, in his capacity as initially chair of the African Union, and later in 2021, at the 34th sitting of the African Union Council, he was appointed as the COVID champion. And through that appointment, and in the previous year when he was, when he chaired the African Union, he did a remarkable job with a team of people to achieve 2 things. The first thing is he appointed Stavros Nicolaou, who is a tech mobile. He's the founder of Econet, as you know. She's a mobile company. And he got appointed as a special envoy for COVID for Africa, for the African Union. And he was able to do 2 things. One, aggregate the volumes on a platform for Africa so that Africa started buying with volume. So instead of being left out in the cold, as happened in the initial phases, we now aggregated our volumes. So now we're buying for 700 million people instead of the sporadic piecemeal 1 million here, 2 million there. And, you know, the Europeans, the Americans had scale, and they were able to secure these vaccines a lot earlier. And as I said, deeper pockets. So that's the first thing the president did. The second thing is he became a strong champion to say we cannot rely on the rest of the world when it comes to a pandemic. We need to set up our own capacities in Africa. And since then, just about every multilateral institution, whether it's a WTO, WHO, anything that starts with World Bank, World Trade Organization, all of them, they all started coming to the party to support this policy shift. And ladies and gentlemen and friends, why should there not be this shift? Why should it be that Africa has the biggest disease burden of any continent, yet we import all our medicines. I told you earlier, we import 99% of our vaccines. So put very differently, countries like India and Europe have leveraged African volumes to create industries in their countries, create the jobs there, get the value add, the taxes, the skills, and all the rest of it. So we've kind of outsourced all of this when we've got the biggest disease or the worst disease burden. Makes no sense. So the really encouraging bit in all of this, in this, the vaccine nationalism, some people call it vaccine economic diplomacy, there are many different names, it all means the same thing. All it meant is Africa were at the back of the queue and everyone else got vaccinated first. And until and unless we've got our own vaccine manufacturing capabilities, we will forever be at the back of the queue. So you can call it diplomacy, you can call it nationalism, you can call it apartheid, whatever you wish. The bottom line is you have to solve your own problems. And this is what Aspen has gone about doing. So we've made this capacity available now. But as I said, contract manufacturing, not good enough. So what did we do? And that's why I raised President Ramaphosa. I'm going to start concluding now, Morris, because the African Union said enough is enough. We need to have our own institutions backing our own companies. And we agitated for a license. And I must commend Johnson & Johnson here because they are the first company to have been serious about putting capacity on the African continent. So last November, Aspen concluded a non-binding term sheet with Johnson & Johnson to acquire the intellectual property rights for the Johnson & Johnson vaccine. What does that actually mean? It means now that Africa has its own vaccine. It will be called the Spinovax. By having the rights to the intellectual property, it means we now take ownership of that intellectual property. We can produce that product under our own brand name, brand label, and we can then distribute it into the markets that we choose. We're no longer at the whim of anybody else to say, look, 50% goes to Latin America and 20% to Europe, whatever the case is. We are now in a position where we can determine the fate of where this product goes or where this vaccine goes. So if we say, well, 10% is going to Nigeria and 5% to Kenya, then that is the case. So Africa now has its own vaccine. It doesn't depend on others. It makes its own decisions, its own calls. That's a fundamental and radical shift. My last comment, Morris. Okay, so this sounds like a fantastic breakthrough, and it is a fantastic breakthrough. However, when you are in manufacturing, the most important two things are, and Morris, you know this very well because you and I have discussed this previously. You need to have sustainable volumes in your facilities. So it's no use putting up these facilities. I've always joked on these calls with the World Bank and all of these guys. I've always said, Africa is known for African elephants. It must never become known for white elephants. So we can't put these facilities up. And the multilateral procurement agencies and institutions, Gavi, COVAX, UNICEF, and others, we cannot have them still buying the product out of Europe and India. So for Africa, they must buy their demand out of African companies so we can sustain these facilities and these capacities on the continent. So in conclusion, I've tried to trace a journey here. I could have spent a lot more time. And in fact, before I conclude, let me give you, I've been through many highs and lows. It's been a roller coaster ride in the last 24 months. Probably my biggest disappointment was on the 14th of January, 2021. I phoned the European Health Commissioner, who happens to be a lady of Cypriot origin. You might have worked out my origins also Cypriot. So I thought, okay, I'm in with a shout here. And I said, Commissioner, we want to swap AstraZeneca that we've got because we've got a beta variant, you've got an alpha variant. Want to swap it for Pfizer? And she said, I'm sorry, I can't help you. That's a different discussion for different, but very disappointing, I must tell you. And that showed me that you need to have your own manufacturing on the continent. So that was a low. There've been highs. One of the highs is getting a license. So let me conclude then with the following two statements. Number one, as I've said many times on this call, we need to have our own capacity, but we need to ensure that it's a sustainable capacity, whether it's for this pandemic or any future pandemic that manifests. We've got to make sure as Africa that we've got capacities that are sustainable. Far too often, these multilateral organizations don't procure from African companies. All we do is we downsize or shut down the manufacturing capacity. And the second of the final 2 points I want to make is we must never, ever doubt ourselves, Morris, as Africans. I was reading today, Mark Cutifani, as you know, is retiring, he's moving on. And he had he's Australian. I mean, he had very good things to say about South Africa. And I think we're often overly critical, not saying we don't have challenges, of course we do. But when we put our minds to something, I think we're quite a force to be reckoned with. And who would have thought that in the space of a few months, company Aspen, South African owned, South African bred, would have made capacity available to make vaccines for an organization as big and as influential as Johnson & Johnson. So never doubt ourselves. We can do it. We've got a good track record. We've demonstrated it. Morris, it's been a great pleasure. I'm sorry I overstayed my welcome a little.
No problem.
It's such a fascinating story, and one that we've got to write up with the business school sometime. Thanks very much.
I'm glad we're recording it. We'll definitely write it out. I think, first of all, I would really like to give Aspen a round of applause. I mean, if you can join me, I'll really have, because when this pandemic started, the biggest challenge we faced as Africans is that we were the last in the queue. I mean, everybody was vaccinated and our people were dying, and we didn't have any voice. And vaccine nationalism went on, and we found ourselves really in a begging kind of situation. My question really to kickstart this discussion is that now we've seen this, and we've experienced this pain. What are the lessons that you can articulate for us as Africa in the event of the next pandemic? What are the lessons we've learned here to prepare for ourselves in the event of the next pandemic?
Morris, we've learned many lessons. Let me focus on two.
Yeah.
The first is you cannot plan for a pandemic at the start of a pandemic. You have to plan in between pandemics.
Yeah.
So supposing we are at the tail end, and I'm not saying we are yet, right? Yeah. I don't want to cause this air of complacency that we're out in the woods with COVID.
Yeah.
We might well be, but time will tell. So we now really need to start planning for the next pandemic, and we don't know what that next pandemic will look like. I mean, most of these things are viral, sometimes they're bacterial, but you need to start having or establishing that capacity, because vaccines are injectables. So whether they are vials that you make or pre-filled syringes, we need to ensure we've got that capability on the continent. But we also need to learn on another lesson, which is we have had capacity previously on the continent. Let me give you an example. About 15 to 20 years ago, we had 3 penicillin facilities in South Africa. Of course, our government carried on importing penicillins out of India, and we shut down all 3 facilities. In fact, one of these facilities was taken over by a BEE pharmaceutical industrialist outfit, and they failed as well because they never got support. So that's what happens when you have a demand, but you don't have procurement taking place from your facilities. So 2 big lessons. Let us plan now for the next one, not when the next one starts. And number 2, let's ensure we get these capacities up and we backwardly integrate these capacities. And number 3, and finally, big lesson, And it's not a lesson we've learned yet now, and I hope we don't, because I hope these multilateral institutions will buy from the likes of Aspen and others. But we must learn from the penicillin example that we must service our own demand through our own facility so we sustain it.
Right. Thank you very much. Now, we've seen that this virus mutates very quickly. We had an alpha, we had a beta, and now we've got Omicron. Fortunately, the Omicron, if you're vaccinated, it will not result in serious disease and hospitalization and death. Are we, let's say Aspen, are we ready right now? If there's another variant that really becomes aggressive, are we able to respond pretty quickly before we've got millions of people dying all over the world, or even in our country?
So, Morris, a very complex question to answer, because of course you don't know what another variant looks like, but we do have precedent here. Mm-hmm. So I think the first thing is that despite some quite radical mutations, if you take the Delta variant, there were 33, if my memory serves me correctly, mutations. And that's a lot of mutations, but yet Delta responded to the current crop of vaccines. So it looks like with COVID, and what's interesting with COVID is the mutations don't develop from the previous mutation. Unlike flu, flu, the next strain of flu develops from the previous one. So COVID's been different in that respect. So measles is a bit like that as well. So what is encouraging is that with all these variants that we've had, it has responded to the current crop of vaccines that we've got. But that's not good enough, because what happens if you do get a variant, I don't know, Sigma variant or Omega variant, whatever it is, okay, because we will get other variants. We're just hoping that these other variants are pathogenically as muted as was Omicron. But if you get others, and let's say they don't respond to the vaccine, what is really encouraging for me is the new vaccine technologies that we have developed, the mRNA technology, can be adapted within weeks to give you a new solution. So that's the encouraging bit. One of the biggest learnings as well with this pandemic is we've done a lot of the processes in parallel. And that's why we got to a vaccine in 320 days. It's unheard of. Normally these things take you 4 years, at least on a good day. So we do have alternate technology platforms that we can pivot to address a variant that's unresponsive to the current crop of vaccines.
Good. Please, people who are participating in the panel in the webinar, you're welcome to put your questions on the chat. But let me ask this question around our capacity. You have the capacity here in South Africa. Is it scalable to reach out to the entire of the continent, or do we need to have capacity, for instance, in West Africa, in East Africa, and in order to be able to locally manufacture and locally distribute, and making sure that the supply chain is robust?
So Morris, we need a bit of both. We do need some regional capacity, but you don't want 55 different plants either, because then you're not going to get the economies of scale, and then you're going to fail because of that. Yeah. So you do need a model where there is regional capacity. The problem you've always got, of course, is now every country wants to put this up, and some of them have got the capability and others, and it becomes a very it becomes a very politicized discussion that we've steered clear of.
Yeah.
So short answer, we do need regional hubs, maybe East and West Africa and Southern Africa. Of course, there's production going on in the Maghreb countries, in Egypt primarily. I wouldn't go beyond those 4 regions. Yeah. And then in terms of Aspen's capacity, We currently have a capacity to manufacture around 400 million doses. Africa, depending on which vaccine you use and whether it's a single or a double dose, and now there are boosters coming, etc. But to get to that 70% immunization mark that the World Health and the Africa CDC were talking about requires you to make around 900 million vaccines. And if it's a double dose, then it's 1.8 billion, of course. So Aspen's capacity at present is 400 million. Can we expand that to 1 billion? We definitely can.
Okay.
The trick, Morris, is, and you've sat on many boards, how do you explain to your board that you want to go from 400 to 1.1 billion, but you don't know if UNICEF, Gavi, and COVAX are going to buy from you?
Yeah.
If they came forward and said, well, here's an order book for 1 billion. Now, they've said that publicly, but, you kind of need to see the orders here. So let's see the orders, and we can quite swiftly increase our capacities, in fact, triple them.
Great. Please come with the questions. I can see them, but let me just follow this line of thinking. Very important that there are regulatory, legislative, policy framework. In my experience, being in energy business, is that before you make a major investment, you've got to jump through a number of these hurdles. And I know in your industry, it's probably one of the highly regulated industry. What is your message to our regulators and policy? How do they make the conducive environment so that you can be able to manufacture without too much hassles, and we can build this capacity? Or maybe what are those policy changes that you had to influence? Because I guess this was a number of things that you needed to jump in terms of regulatory and policy framework.
Look, I think the starting point for me is our country can certainly be a lot more investor friendly and investor efficient. Right? I think we know that. There's very often regulatory disharmony or a lack of coordination very often across the departments. So kind of getting all the departments together working in sync is an area we can certainly improve on. Of course, the water and the electricity situation in the country are challenging. I must say, though, as much as water continues to be exceedingly challenging in the Eastern Cape, what I did find is the provincial government were very responsive. They might not always solve the problem, but they're very responsive. So we do need to have a better energy and water security in the country if we are to attract other investors. The asset test for me here would be, would an Indian company come and put up a vaccine plant in South Africa?
Yeah.
Or wouldn't? It's very different if Aspen does it, because Aspen, this is our home base, right? And we kind of understanding, there's a patriotic element here, sometimes naively patriotic, but there is one, and you'll back your country, and you hope it works out. But would an Indian, a European, they're saying, look, we're going to put up a plant to manufacture 3 billion doses. Are they going to put it up in Europe, in India, or in Latin America? And that's the way we've got to look at it, Morris. So there's a lot to be said and done around policy cohesion, around cutting red tape and regulatory admin and burden. Pleasing that Sipho Nkosi, who you and I both know, has been appointed in that position. Yeah. It's not an easy job for him, and he must never get drawn into the detail or get pulled into the weeds, because that's exactly what happens. You get pulled into the weeds and you never get out again. Yeah. So there are all of those elements, being absolutely frank with you, Morris, that we did have to traverse. It's not an easy road. We are in discussions at the moment around an SEZ, IDZ supplier park for pharmaceuticals. because you're going to make 1 billion doses. I mean, why do you want to import 1 billion glass vials, 1 billion of those rubber stoppers and caps that I spoke about, and even, 1 billion labels and packs?
Yeah.
Why do you want to do that when you can get all of, we can put that up in our own country? Let's rather just put it up in our own country. So we are engaging government, they are responsive around the supplier park, pretty much like the Ford supplier park in Swanepoel. That type of arrangement.
It's a real opportunity to spawn a number of businesses out of this, as you say. I mean, there's probably a lot of services and manufacturing of supporting goods that could be, and maybe it's something that we need to unpack quite a lot and see what other businesses could be created. One last question from me. I wanted to have a question which I crafted a long time ago. Can Africa leverage from Brics countries? I'm not too sure about it, with Russia being in a big war now in Europe, whether
Maurice, you're putting me on the spot here.
In enhancing and creating additional capacity. But I'm hearing you saying we need to develop our own capacity. We need a lot of orders coming in order to sustain our capacity. What we cannot afford is to have other players entering our market, and we need to have some kind of ensuring that doesn't happen. But talk about Brics. Was there any cooperation in this regard?
Maurice, there was, and I've got probably a slightly unique vantage point here because I sit on a Brics Business Council, which is a council of 5 representatives from each of the 5 countries. Of course, it's exceedingly tricky being on there at the moment, right? Because Brazil voted against, in the UN Security Council. And so in India, China, and South Africa abstained. So I'm not going to discuss the geopolitics, but unfortunately, the geopolitics did also play out during the pandemic. For example, India placed export restrictions on medicines, and very often these were raw materials or basic medicines that we needed during the pandemic. So that's another reason why you want to have your own local manufacture, because we saw both Europe and India place export restrictions. So the little bit of leverage we had within Brics is when those export restrictions started to bite, we did have some leverage. Minister Patel got involved. I know we spoke council to council, and some of it was released. So I'd say there was some cooperation there. Then on the PPE front, as you know, a lot of the PPE, the masks and other things were manufactured in India. And when we were at the height of not being able to get PPE, you remember March, April 2020, those were harrowing days, they really were. And I was working as a volunteer in business for South Africa. We were getting PPE for the country. And there was some assistance from China there, particularly one of the Chinese companies supplied 2 million K95 masks, all of which were defective, and they wouldn't take them back. So we had to lean on our Chinese relationship through Brics to get them to take this back, because this was 100 million rand of solidarity fund money. Now imagine trying to have to account to the public how you bought 100 million rand worth of masks and the Chinese wouldn't take them back. So that helped in that instance. Okay. It got a lot more messy with the vaccine. So because you had competing interests, you had the Chinese, so you had the Indians competing with the Chinese competing with the Russians. The Russians felt aggrieved because the WHO, the World Health Organization, has not approved their vaccine. The Indian and the Chinese ones have been approved. And then, of course, the Aspen one was approved. So it became a lot more tricky with the vaccines.
I can imagine.
The Russians.
Let's get into the competitive environment.
Correct. But there were areas of cooperation.
Yeah.
When there was sort of the interests were more or less aligned, but when it got to vaccines, it frayed a little.
Somebody asked Jean Tutoit says, how does Aspen deal with the challenges of load shedding at their manufacturing plant? I mean,
the answer is with great difficulty.
I can imagine, yeah.
Look, I think load shedding is a reality at the moment in the country, and you'd be foolhardy not to make or have backup plans. So we have got backup generators and the likes thereof. Most of the time it's effective and it works. There has been the odd occasion where that has slipped, and it's unfortunate. But by and large, you've got to make up your own. You've got to have your own backup plans, as is the case with generators and things. And then, of course, you rely on government to assist you where you can. There's the issue around national key points. You can look at these facilities being appointed as national key points.
It is definitely, it must be. Just coming back, the Afro-pessimism is quite hard. So it was something made in Africa. What quality control processes that you have for physical and digital and then compliance also to assure people that made from Africa is compliant and it's of highest quality and it's safe?
Look, I think there can be no better quality endorsement than when Johnson & Johnson ask you to make their product, and they are the ones that do the testing afterwards. So Aspen produces a product, we do the testing in our own facilities, and then it gets shipped off to Belgium, and Belgium does the testing as well. Now, Belgium has not, Belgium and Netherlands, both of them, neither of them have failed a single batch of what Aspen has produced. So I think we've got the quality standards, we've got the quality testing capabilities in our country. And in fact, because these are called biologic products, because they're either made from live organisms or live attenuated organisms or mRNA technologies. So they are required to every single batch is required to be tested. And the laboratory is actually in Bloemfontein. It's the national laboratory, the National Quality Laboratory. So they test it first and then it goes overseas for further testing. And as I said, not a single batch has failed. So I think that's a big endorsement of our quality.
That's very good, very good, very good. I'm pleased to hear that. There's a question here about AFCTA, the involvement of other countries in what other African countries will be part of the pharmaceutical manufacturing plants with the AFCTA progressing. Does Africa have the capacity and infrastructure to sustain such an initiative? I think this whole Africa trade agreement that we've been signed, I think the question is around, is it going to help? It's going to facilitate, and are we going to work within that framework in vaccine manufacturing?
Yeah. So for me, all of these trade agreements, what they set out to do is what I explained when I was going through the AU piece. The continent is so geographically diverse. It's someone once said it's a homogeneous continent. It's not. Every single country is different, and provinces within countries are different. So it's a very heterogeneous continent and very geographically diverse, demographically diverse. And that means that our volumes get fragmented, unfortunately. So these free trade agreements, the Avid platform that I spoke about earlier, what they set out to achieve is to give you an aggregated volume. When you've got an aggregated volume, then you're in a different negotiating position. Now, it's probably surprising that it's taken this long to get this aggregation mentality going. But we are getting it going, and that's very pleasing for me, including through the free trade agreement, but also the platform that President Ramaphosa and Strive Masiyiwa set up.
Just a question for people who are anti-vax. We know that there's a great movement around that. And obviously some people have used constitutional rights, some use medical reasons. But there's this, lots of people are saying, no. How can you make a vaccine in less than a year? And normally vaccines are tested and tested and tested. And I grew up in the township. There's a strong rumor out there in the township that we who vaccinated in 2 years' time will be dying like flies, and those who are not vaccinated, they'll be fine. So there's a lot of people who have got this wait and see. What is your message to people who are very skeptical of the fact that there was just so much speed, and therefore this is still an experiment, not a real thing?
Look, the good thing about vaccines, if you're going to get side effects or adverse events, you'll see them in the first 2 weeks.
Yeah.
Usually you'll see them in the first 48 hours. So the first vaccine was administered in December 2020.
Yeah.
So we are now 15 or 16 months on. I'm kind of losing track of time. It's 16 months now.
Yeah.
So Morris, we'll see what happens in another 8 months when it's 24 months, right? But I've heard all these stories where they said, and they give dates. They said 31st of July, all of those last year, all of those that were vaccinated going to die.
Yeah.
There've been very few, if any, deaths from vaccines.
Yeah.
There've been the odd thrombotic episode. And many, when you investigate this, many of those patients actually would have had that thrombotic episode anyway. So my message is the following. I think we need to be factual around these things and not deal with anecdotes, right? That's the most important learning for me here in all of this, because you hear all these anecdotal stories, but yet there's 11 billion doses that have been administered. The world's population is 8.5 billion, Morris, if I remember correctly, there or thereabouts. Yeah. So if you've administered 11 billion, then you've given, at least 5 billion. Some have had double dose and boosters. So, but let's say 5 billion. So we should have seen 5 billion people dying, according to some of these anti-vax groups, many of which have a religious cult theme attached to them, incidentally. Right?
Yeah.
The mark of the beast.
Yeah.
Many times I had family members who you'll end up having these fights, Mario. I'm going to have to ask you to come and reconcile, because they honestly believe that there's a microchip in there. And I said, there cannot be a microchip. The quality, any little inkling of foreign substance. I said, do you want to go into our factory? Okay. I said, not even the most minute germ will get through. And you're telling me like a microchip's going to get through. Yeah. So, those are unfortunately the things. And it's a fear factor that plays out, Morris. I don't have the answer, to be honest, because we've really grappled with this. And people tell you all sorts of things. You're doing the work of the devil and all the rest of it. I mean, I got an order, an award from the Orthodox Patriarch and Pope for work that I did with COVID. And at that same presentation, you will not believe one of his priests was an anti-vaxxer and started, he started making these noises when I said to the Pope, but this is your own guy, you must sort him out. So I don't have the answer, Morris. The only thing I can tell you is we've got to look at the facts. At 11 billion doses, very few deaths anywhere around the world.
Yeah.
And we are 15 or 16 months on. What I can tell you is the reverse, though, for the anti-vaxxers, is that the efficacy rates are very high. I gave you an example earlier, that those that are vaccinated the infection rate is 68% lower than those who are unvaccinated.
There's a question here, that, again, just following the conspiracy theories around it. It says, what is your thought about the narrative that COVID-19 is a made virus by the rich as a way to decrease population of the world?
Well, you see, I mean, if it's to reduce the population of the poor, ironically, a lot more rich have died, significantly. So, you know, when I was giving you the numbers earlier, that you've had 6 million deaths globally. Africa is sitting at well below 500,000 of those 6 million. Okay, so if that was what they set out to do, they haven't succeeded. It's had the reverse effect, unfortunately. So that would be my answer.
Yeah, no, you're absolutely right. And then there's a question which is obviously quite a controversial one. We know that our continent is susceptible to corruption. How will we prevent a counterfeit medication?
Morris, that is an excellent question.
Yeah.
The only way to prevent it is you've got to have a proper track and trace capability. Yeah. So the vaccines that we're producing are serialized, meaning that they've got digital technology. You know, it's an advanced QR code that we use. So you're able to track and trace that particular vial, or there are 5 doses in a vial. So you can track that vial basically to the point where it goes into the patient's arm, so to the point of the clinic. And that's the only way. I mean, were it not for that, I think it would be free for all, to be honest.
Yeah.
It's a very effective way. And what it does is it puts counterfeiters and fakers, it acts as a significant deterrent, and they turn their attention to other products.
Yeah, let's hope for the best for that. That's a very good conversation that we have had. What is, if I were to say, what is the message that you would like to conclude with this discussion? And basically to our listeners here, and given the fact that we're recording this message, we will be playing it all over again to many people who could not attend it. And let me give you the time to give us your message.
Morris, there are 2 messages here. The one message relates to the topic we discussed today, and I'm going to make that as the second message. There's another message that I do need to try and reinforce on this call before I get to the manufacturing, the capacity, local capacity message. The message is that these pandemics, they operate in peaks and troughs, or you get a waxing and a waning. Fortunately, we in a significant phase of waning rather than waxing, which is very good, of course, and that's what we've kind of all hoped for. But we should be aware that there will be a 5th wave in South Africa. That 5th wave will probably be triggered by another variant, more than likely.
Triggered by?
So, by another variant.
Okay.
Okay. So, like you've had Omicron now, and the thing with Omicron is it was 4 times as transmissible as the first variant we had, the one that we had in March, April 2020. It was 4 times as transmissible, but it was less virulent, thank goodness. So we need to keep vaccinating people, and this is the message. People need to take their vaccines, they need to get their booster shots, because that is the best way of preventing these variants. Why? Because if you are boosted, or you've had if you've had your vaccine, you are less likely to transmit the virus to the next person. And I gave you that 68% story earlier. So the message number 1 is let us not be complacent. We still need to go out there and get vaccinated so that we prevent another variant that suddenly upmutates. Because we just can't afford to go through another hard lockdown again and all the rest of it. So go out there and get vaccinated. If you have been vaccinated, go and get your booster shot. So that's message one. Message two and final message is we need to keep agitating as South Africans and as Africans that we develop our own capacities and capabilities on the continent, not least because of the audience that I'm speaking to here today. And I hope other people in the university get to hear this message as well. If we don't have our own capacities, if we are outsourcing our volumes to India and to Europe to manufacture these products, we're not going to keep our scientists here, our talented scientists.
Oh, yes.
And we need support, volume throughputs through these facilities so that we can keep our young, talented scientists, our medical experts. We need to keep them here in South Africa. Far too often, I travel abroad and I see this brilliant person in around. Who is this person? And they're South African. And they're not in our country. Why? Because we didn't have the capacity to keep them here. So those are two very, very important messages. Let's not be complacent. Let's go out and get vaccinated. And number two, let's make sure we carry on agitating for local capacity on our continent so that we determine our own future and we keep our talented young people in South Africa where they belong.
That's a great message. Can I just ask one question because somebody asked me, is it going to be now an annual vaccination like the flu jab? Or are we done with our third booster? What is your take?
Maurice, we don't quite know that yet because we don't have the benefit of time to work that out. It's very likely that it will go that route. Now, the reason I'm saying that is because we're on this downward mutatory trajectory, right? And eventually these pandemics do settle, they get into some type of a steady state, like you've got with influenza. So influenza is highly transmissible, but of very low virulence or pathogenicity, right? So I think we are edging towards that, and that will mean you probably will need an annual dose. But in the absence of declaring that this is over and it's not endemic, we don't quite know that yet. We've got a watching brief on this, but very likely it will be the case in future years.
Yeah. Let me really thank you, Stavros. Thank you for the tremendous work you're doing for this nation. And having known your heart, your patriotism, and you have spent your life really serving this nation in every capacity that I've seen you and have known you for many, many years. So we wish Aspen great success. And I think if there's anything we can do as a business school, in fact, we're developing a healthcare program. We want to develop a healthcare, potentially a program that runs through MAP, PDBA, and then finally with an MBA healthcare leadership. Because this pandemic has shown us that we actually don't have leaders that can manage our healthcare facilities. I mean, not only us, but the whole world, because we all kept caught napping on this one. So we will invite you to come and be part of the panel that helps us think through what is the content of that course and that module in order to develop the next generation of healthcare leaders that can be able to avert, fight, innovate creatively, and help us navigate the next pandemic. Thank you very much for your time. We truly appreciate you. Thank you, all the people who
Maurice, let me also, so I'm going to get formal now because we're closing. So Professor Gqeberha, it's been a great privilege and an honor sharing the last hour and 45 minutes with you. The university is very close to my heart, of course. And I think keep up these dialogues. They're really important dialogues to be having in our country. So need to commend you for that. And above all, thanks for the invitation and wish you all very well.
Thank you. Wits for life.
Instead of policy for life, Witsy for life. Yeah.
Thank you very much. Let me thank our technical team, Tembeka and Jayton, and everyone behind this and those that are tweeting on our behalf. Thank you very much. Stay safe, stay healthy. And again, the message, if you haven't vaccinated, go now quickly and vaccinate. Thank you very much.
Thanks very much. Cheers.
Cheers.